We will be sending out an email after this event and sharing ways to support the Alliance. Also, please follow us on social media at Massey Alliance. A few quick housekeeping items. We will be keeping everyone on mute except for the speakers for this call. We encourage you to ask questions via the chat box throughout the discussion, and we will address those during the Q&A. Now, it is my pleasure to introduce my fellow board member, Cassie Schroth, our moderator for today's call. Now, Cassie serves on the Advocacy Committee of the board and helped coordinate today's event. Cassie is a Vice President of State Government Relations at McGuire Woods Consulting. And Cassie, take it away.
Thanks, Connor. Welcome, everyone. We are so excited to welcome two of our very impressive Massey experts to speak today on the exciting research happening in VCU's Center for the Study of Tobacco Products. While we definitely could have a full day's worth of discussion with each of our speakers, we're going to highlight a few areas of their research, learn more about the efforts as Massey members within the Cancer Prevention and Control Program, and have an opportunity for your questions and answers at the end. As Connor mentioned, I encourage you to drop your questions in the chat box throughout the program, and we'll be sure to answer them. And first, I want to welcome Dr. Thomas Eissenberg. Dr. Eissenberg is a professor in the Virginia Commonwealth University Department of Psychology and is the co-director for the Center for the Study of Tobacco Products. He is also a Massey research member in the Cancer Prevention and Control Program. Dr. Eissenberg obtained his doctorate in experimental psychology in 1994 from McMaster University in Hamilton, Ontario. He then spent 2 years as a postdoctoral fellow at the Johns Hopkins University School of Medicine and joined the VCU faculty in 1997. Dr. Eissenberg's primary area of research involves developing and demonstrating methods to evaluate modified risks and other novel tobacco and nicotine products. He has authored or co-authored more than 200 peer-reviewed publications and served as principal investigator on numerous NIH grants, and across his career, these grants total more than $500 million. And I'd also like to welcome Dr. Caroline Cobb. Dr. Cobb is an associate professor in the Health Psychology program in VCU's Department of Psychology and the co-director of Project 3 at the Center for the Study of Tobacco Products. Dr. Cobb obtained her doctorate in experimental psychology in 2012 from VCU with a specialization in biopsychology. She then spent 2 years as the Ellen R. Gritz postdoctoral fellow in tobacco control at the Schroeder Institute for Tobacco Research and Policy Studies at Legacy, which is now the Truth Initiative, a nonprofit organization in tobacco control and prevention. Dr. Cobb's program of research consists of several overlapping areas, including clinical laboratory evaluation of tobacco products, population patterns of tobacco use, and tobacco regulatory science. A primary focus has been investigating the influence of novel and alternative tobacco products, such as water pipes, little cigars, and electronic cigarettes on individual and population health. Welcome, Dr. Eissenberg and Dr. Cobb. We're so happy to have you join us. And obviously you're both very busy with all of your research, and we're lucky to have you. So I'd love to just jump right in with our first question. Dr. Cobb, I think many on this webinar might not know that VCU has a Center for the Study of Tobacco Products. Can you provide us with an overview of the center and how it sits within VCU?
Absolutely. It's my pleasure to be here and to be speaking to all of you. Yes, so I've been a part of the center since 2014 when I joined VCU as a faculty member. Tom can correct me, but I believe the center was funded 1 year before that, around that. That was the first time we'd received this center grant from the NIH and FDA. And the center is composed of 4 main projects. These projects have changed over the years, but in the current iteration, and actually I think I have a slide that shows this that might be helpful in this discussion. Yeah, the next slide actually. Yeah, so this is the current iteration of how the center is organized. So you can see we have 4 main projects and a contextual knowledge core, and I've kind of divided these up into kind of their main areas of focus. But overall, the overarching mission of the center is to promote public health equitably and across populations by developing and applying regulatory science to the evaluation of tobacco products. And the tobacco product of interest for us is electronic cigarettes. And so you can see each of these projects has a specific goal in mind. So project one goal is really around predicting product toxicity using aerosol dynamic methods, analytical chemistry methods. Project two is focused on predicting e-cigarette user behavior among both e-cigarette exclusive users as well as users that might take up e-cigarettes like combustible cigarette smokers. And the primary outcomes of interest for project two delivery and liquid consumption as well as other user behaviors. And project three, which is the project that I co-direct, we are focused on measures of addiction or abuse liability and how we can predict those among both exclusive and dual users of cigarettes and e-cigs. And then project four is, I think, a really unique piece of the center. And this project actually uses the data that projects 1 through 3 provide and testing these hypotheses by testing them in the real world. So projects 1, 2, and 3 are really laboratory-based, both analytical and clinical laboratory-based. And project 4 is testing these population level predictions using a longitudinal study of exclusive e-cig and dual users. And you can see on the far left-hand side, we have what's called a contextual knowledge core. And this is really like our, I want to call them like our qualitative core, but they do a variety of different methods to help us actually come up with some of the questions or the methods that we're going to be testing in those clinical lab settings or analytical lab settings. So that's kind of
great.
like a big overview of the center itself. And Tom, I think we'll talk about kind of where these projects are located.
Right. Thank you, Dr. Cobb. And Dr. Eisenberg, as Dr. Cobb mentioned, is this program unique to VCU? And if so, what's distinctive about it?
Well, thanks for the question and thanks for having me. Before I answer, I just have to correct something in the introduction. You said $500 million. I wish it was $500 million, but 50 million is all.
Excuse me.
I'll keep striving for that 500 million mark.
Absolutely. I think you deserve every penny.
So the answer to your question is no and yes. As Dr. Cobb mentioned, we were first funded as a center in 2013. At that time, we're part of a program called the Tobacco Centers of Regulatory Science. At that time, there were 14 Tobacco Centers of Regulatory Science funded across the country. In the recompeting of the award, which we received in 2018, that number dropped to 9. So there are 9 other Tobacco Centers of Regulatory Science, or sorry, 8 others across the country. So in that sense, not unique, but I think what is unique that Dr. Cobb was explaining is that what we do in this particular iteration of the center is we're focused on predicting the effects, intended consequences or unintended consequences of potential regulations before they get put into place. And when I say regulations, of course, regulations related to tobacco products. And we think this is really important because regulating tobacco is challenging because, of course, we're regulating a product which is addictive that people use. So you're really trying to influence behavior through regulation. And so we're very concerned that regulations meet their intended consequences and don't produce any unintended consequences, which could actually be more harmful for public health. I guess I would like to add that we're perhaps also unique in our collaborations across the country and across countries. So Project 1, the Analytical Lab and Aerosol Research Lab, that's at the American University of Beirut with my friend Dr. Alan Shahade, who I've been collaborating with since I think 2005. We also involve Johns Hopkins, they lead Project 4, and the University of Arkansas Medical Sciences is directing our contextual knowledge core.
That's really interesting. I like seeing all that cross collaboration. When you talk about regulatory impact, does your research impact local regulations, state, national? Is it across the board?
Well, we're funded to inform FDA on its regulatory actions with regard to tobacco. So that's our primary purpose. But I have as has Dr. Cobb, we've been contacted by states who are interested in regulating tobacco products, various other localities. I work with the WHO for global tobacco product regulation. And we've also been contacted by members of Congress, our own Senator Kaine, for instance, who's very interested in electronic cigarettes and keeping them out of the hands of youth. And in the state of Virginia, this is kind of a side note, but I thought it was interesting. When Virginia passed its Tobacco 21 law in 2019, that actually influenced our research in ways that, again, unintended consequences I don't think anyone meant, because the wording of the law, the VCU lawyers told us, meant that we couldn't enroll tobacco users in our studies who were 18, 19, or 20. And our external advisory board was very concerned about this because, of course, youth are using e-cigarettes a great deal. And the more we can study younger adults, the more informed we're going to be. So I reached out to my delegate, Schuyler Van Valkenburg, and suggested that maybe we could amend the law so that IRB-approved studies at universities that are intended to inform regulatory science could be exempt from it. And long story short, he was able to get that through, and it was signed by the governor in, I think, July of 2020, and is now the law of the state.
Yes, I remember that going through the General Assembly last year, and Delegate Van Valkenburg did a great job of advocating for you. So I'm happy that your research, expands into Virginia as well. So getting into your research, Dr. Cobb, could you share an overview of your current projects and what you're working on at the center?
So if we wanted to dive into this more, we could spend all day. I tried to just pull a couple of very recent papers that our team has published. I think we're on track for publishing in the current iteration of the center over 100 papers. Is that right, Tom? So far, we're a very, very productive team.
Yeah, we're
so
at 90 now, and we're
Okay.
aiming for many more.
And that's just in the past 3 years, right?
2.5, but who's counting?
Yeah, no one here. So yeah, I just pulled just to give you a sense of kind of how diverse the work that we do. This is just some example papers. So one looking at marketing behaviors of the industry. So this was done by part of our Project 4 team, the deceptive marketing strategy and early warning of industry behaviors after the pre-market tobacco application deadline. A letter here: treat COVID-19 as though it may be as though it is airborne. It may be. This was authored by Tom and I believe Project 1 director. And then another paper from our Project 1 team: electronic cigarettes are chemical reactors, implications for toxicity. And then a paper from Project 2 team looking at the acute effects of Juul and IQOS, which I'm sure people on this call know what those are, but Juul is like the most popular electronic cigarette brand in the United States. And IQOS is one of the one of the newest products to be approved by the FDA. It's also marketed by Philip Morris, but it's not a combusted tobacco product. It's actually a heated tobacco product. And we have an IQOS store in Carytown. We're one of the few places where you can access it very easily. So this was one of the first 2 studies to really actually look at the nicotine delivery and acute effects in humans. So just to give you a sense of some of the stuff that we're working on.
That's great. It's a wide variety. So for each of you, could you provide more details about one of the projects you're working on now and describe its purpose and maybe the goals, or if you have any findings from the project already?
Yes, and that's actually the next slide I wanted to bring up. This is the main, one of the main research questions that we are studying right now in both all of the projects 1, 2, and 3, with the goal of integrating the results ultimately into Project 4. And this relates to the concept of nicotine flux. And so for those of you on this call, that term may be new to you. So I just want to kind of walk you through it. So when we say the word nicotine flux, this gets at the amount of nicotine that's actually delivered to a user. So a user of electronic cigarettes is a function of the rate that the drug is emitted during a puff. That's what we call nicotine flux. and the duration, which is also influenced by the duration of each puff and the number of puffs taken. By way of an analogy, you can consider this as like a water faucet that's either dripping slowly or flowing freely. Dripping slowly is a low flux product in terms of the water emission, so how much nicotine is getting out, while flowing freely is a higher flux. And so if you're holding a cup of water underneath that water fountain or water faucet with low water flux, you might get a small amount of water. But if you hold a cup for 4 seconds, so the same amount of time, but the faucet is turned up, you're going to get a lot more water, right? And a lot more nicotine. So that's why we care about how much nicotine is emitted from an e-cigarette on a per second basis. And the reason we care so much about that is because the speed of nicotine delivery and how much gets into the body, how quickly it gets into the body, tells us something really important about abuse liability. So we know that Juuls, for example, have a different nicotine flux than, say, older e-cigarettes, some of the first e-cigarettes that were out on the market. Though the speed of nicotine delivery differs for those products, which is why we want to measure it and test the influence of that characteristic. And this could be a potential place that FDA could regulate for e-cigarettes. They could, instead of giving let's say a nicotine concentration in liquid, that they would say, we are not going to allow any e-cigarettes that contain a liquid that contains 20 or more milligrams of nicotine. We think that that kind of restriction, it actually ignores this flux capacity of the product. And so flux could actually be a really important regulatory target for the FDA. And so our goal of the current set of studies is to show how that's possible. And that, I think that gets me to the next slide, which we are actually testing out in the clinical laboratory setting, different flux scenarios. So how different fluxes might play out in a human who's using those products. And we're testing all of those outcomes I mentioned previously: the nicotine dose that's delivered, the nicotine in the blood, the abuse liability measures, how they puff on these devices, all those outcomes. And so that's kind of where we are right now. And I unfortunately don't have any data to show you because we just started collecting data again in the lab due to COVID-19. The flux studies, as we call them, were paused for quite a bit of time, but we are now back enrolling with all types of COVID precautions, but now safely collecting data again in the lab.
That's great. Thank you, Dr. Cobb. Dr. Eisenberg, do you want to tell us about one of your projects?
Yeah, there's one I'm really excited about. Before I get into it, I just want to point out that Dr. Cobb mentioned 2 potential regulatory actions, and that give you a perfect example of what I mean by intended consequences and unintended consequences. So she talked about regulating liquid nicotine concentration, which is in fact the regulation that's been in place in the EU since 2014. You can't buy in the EU liquid nicotine greater than 20 milligrams per milliliter. And the intent of that regulation, it's written in the regulation, is to make sure that e-cigarettes don't deliver more nicotine than a combustible cigarette. So now we know the intended consequence, and we know from our work in Beirut and here that that regulation is not going to achieve its intended consequence, because nicotine delivery to the user is a function of more than just concentration of the liquid, and particularly device power or wattage. And so high power devices, you could put a 4 milligram liquid in a 70 watt device. Juul operates at around 6 or 8 watts in a 70 watt device and get way more nicotine in your blood than a combustible cigarette. So all the EU folks have to do if they want to get more nicotine is just increase the wattage of their device. And there are unintended consequences to that, because the more device power you get, the more chance you have of overheating the liquid, which causes thermal degradation of the liquid and volatile aldehydes to form, which are dangerous for our lungs. And so that's a perfect case of a regulation that's not going to meet its intended consequence and could have unintended consequences which are bad for public health. In contrast, we think regulating nicotine flux, which takes into account all of the factors that can influence nicotine emissions simultaneously, is a much better regulatory target. Switching to what my favorite study is, so we have let me back up. There's what I believe to be a myth, that in order for e-cigarettes to help people quit smoking, they need to be flavored with Fruit Loop flavored or creme brulee flavored or cappuccino flavored, or there are about 5,000 different flavors you can buy in the US now. And so I'm really interested in that because, of course, flavors are things that are added to the liquids. That means more toxic in inhalation, more chance for thermal degradation. And so what we're doing is a study of unflavored liquids in cigarette smokers and asking them the simple question, how hard would you work or how much would you be willing to pay to receive puffs from this e-cigarette that delivers nicotine using an unflavored liquid, and comparing the answers to those questions to an own brand cigarette. So I give you an example. We bring participants in who are overnight abstinent. They're cigarette smokers, but they haven't smoked in the morning when they woke up, and they run quick to the lab so that they can receive a tobacco product under controlled conditions. And we give them a space bar, and we say, look, you're going to have to work, press this space bar 10 times, and then we'll give you a puff. And we keep escalating the amount of work required, the amount of space bar presses for them to get more additional puffs from that cigarette. So the most they can earn is 10 puffs, and with 5 participants who have completed the study, the average number of puffs they've earned is 9.4. They pressed the space bar approximately 700 times in order to get that. So the question is, do the e-cigarette unflavored liquids, are they willing to work for those also in a different session when they're, again, overnight abstinent? And the results I'm going to give you, unfortunately, because we're blind to condition, are going to blend placebo e-cigarette, no nicotine, versus active nicotine. But I think you'll get the picture. They've earned an average of 6 puffs, and they've pressed the space bar 650 times to earn them. So to me, even that preliminary result demonstrates that cigarette smokers who are in need of nicotine are willing to work to self-administer nicotine in an unflavored liquid. And it may be that if e-cigarettes are going to help people quit smoking, and that's a very large if, that we should eliminate, or we could eliminate the flavors, still get that outcome, and reduce the abuse liability of these products for youth and young adults.
Right, we've heard so much about the abuse liability for children, and Mango Jewel comes to mind. They were after that was banned, it felt like everyone was running to get those, and it's so interesting to learn that maybe unflavored would actually help people and keep it out of the hands of kids. So now I want to switch a little bit to more about the center and how it fits into VCU as a whole. So Dr. Eisenberg, how does your research fit into the research that Massey Cancer Center does and maybe the prevention side?
Yeah, well, of course, tobacco cigarette smoking is the leading cause of preventable death and disease in the United States. One of the main causes of death of cigarette smokers is, of course, cardiovascular disease, but also cancer. And so I think we fit really well with the Massey Cancer Center, and we interact regularly with the Cancer Prevention and Control Program. We actually used to have a WHO collaborative center that the Massey Cancer Center funded for us. But unfortunately, because different units of VCU attract money from Altria and other members of the tobacco industry, the WHO was no longer interested in maintaining that affiliation. But I think we fit really well with everything Dr. Wynn is working to improve on what Dr. Ginder had done.
That's great, thank you. And how's the research funded? I know you mentioned some partnerships with WHO in the past, but how's it funded now?
Yeah, so this is one thing I'm always tickled to be able to explain, because sometimes I hear, why are my taxpayer dollars being funded to study tobacco products? Well, the quick answer is they're not. If you go to the Family Tobacco Prevention and Control Act, which is the law that gives FDA the authority to regulate tobacco, you will see in it a very detailed fee schedule going by year of how much the regulated industry, the tobacco industry, needs to pay FDA in order to be regulated. And that's in the hundreds of millions of dollars per year. And so FDA decided, and I think wisely, of course I say that because I'm a researcher, that they needed to be informed by research on how best to regulate tobacco products. So they shipped a whole bunch of money over to NIH and said, would you please administer a wide variety of tobacco regulatory science programs, including the Tobacco Centers of Regulatory Science. And that's the money that funds our center as well as the other TCORs. So it's not taxpayer dollars, it's dollars that are paid to FDA by the regulated industry that are then shipped over to NIH to fund our work.
That's really interesting. And I know you mentioned that When we were first funded, there were 18 other centers, and now we're down to 9. Is that just a function of research becoming more specialized? Is that a function of maybe a decrease in funding, or how do you see the smaller number either being more productive or less productive?
Yeah, I went from 14 to 9, and
14.
I think that's a you're asking me to speculate, which of course I'm happy to do. I think in some instances, folks who had the centers in the previous iterations underestimated the need to publish, which is why I am in fact counting all our publications on a regular basis, because it's through publications that we inform FDA of our results. And I think it's also sometimes a lack of appreciation of what tobacco regulatory science is. So basic science, for whatever, well, yeah, for whatever reason, FDA has decided basic science by itself is not necessarily what's going to inform their regulatory action. And so what they're really looking for is, I guess, what I would call applied science. And I think one of the reasons why our second iteration was scored so well was because we're directly informing FDA about potential regulations that they might put into place. And what we're suggesting to them is, while we're focusing on 3 different regulations, hypothetical regulations, what we're suggesting to them is anytime you think you want to put a regulation in place, first test it in the clinical lab, because we've demonstrated that the clinical lab predicts really well what happens in the real world, and you can get some very cost-effective, efficient results, and you can determine from those whether your proposed regulation, again, is going to have its intended consequences. Is it going to produce any unintended consequences that are harmful to public health? So that kind of applied science, I think FDA was really, really interested in.
That's great. Yeah, the applied science, as a, in my professional life, I'm a lobbyist, so I know how long regulations can take and everything else. So do you think that with all of the new types of materials, FDA has really switched the focus of funding to e-cigarettes away from traditional cigarettes, or as well?
There's certainly the need for cigarette research. So there's another center also funded by FDA called CNIC. I can't remember what it stands for, but they're focusing on what would happen if FDA were to reduce the nicotine content and delivery of combustible cigarettes. How would smokers respond? Would they quit? Would they switch to other products, and so on? But to get to your question specifically, I've been studying novel tobacco products and how to evaluate them since 1999, since Accord was first advertised. That's a heated tobacco product, a precursor to IQOS that Caroline mentioned, that Altria developed. And I think it was in 2004, I wrote the first grant NIH ever funded on how to evaluate novel tobacco products. In 2012, when we were putting together the center grant application the first time, I decided, not FDA, to focus exclusively on e-cigarettes. And there were a lot of questions. Caroline wasn't here at the time, but there were a lot of questions amongst the folks we were collaborating with. Well, why aren't you studying hookah? Why aren't you studying smokeless tobacco? And I was like, e-cigarettes are going to be the next big thing. This is what we need to focus on. This is going to be FDA's biggest problem moving forward. And so FDA has encouraged us to look at novel tobacco products. I think we've been encouraging them to really focus on them in their regulatory activities. And of course, the huge upsurge in e-cigarette use among youth has only pushed that argument forward even more.
Wow, and how right you were. It is such a interesting topic for regulation and research. So how has COVID-19 impacted your research?
Yeah, I could speak to that. And actually, I want to add something related to kind of how the research program that I am a part of, both at the center and then also my independent work of the center, which really isn't independent. I feel like the center is, what I do is kind of built in. It touches all the things I study, but I've been lucky enough to be supported by Massey and several other projects. So I've gotten funding as part of the pilot projects to study cigars in low-income communities. We were also able to do some really exciting work, again, kind of outside of the center's aims, but leveraging those Massey resources to think about public health consequences of other types of tobacco products. So I'm really grateful for that. And also I've had the opportunity to work with other members of the Massey Cancer Center team, not only those in cancer prevention and control as part of those projects. But speaking about COVID-19, yeah, this was, this threw us for a huge leap over a year ago, right? We actually were about to go, all of us were about to go to this conference in New Orleans. This is called the Society for Research on Tobacco, Nicotine and Tobacco. And that's when all this kicked off and things just completely changed for us. We had to shut all of our in-person lab studies down, which is a huge part of projects 2 and 3. Project 4 was able to continue as best I could because most of the survey-based studies were remote. But yeah, this was a pretty big disruption to our in-person lab studies that, like I mentioned, only towards the end of 2020 have we been able to reinitiate those just due to administrative changes we had to make to all of the protocols, had to get those approved by our ethical review boards, the group in charge of monitoring the health of the campus. So we had to go through several new layers of approvals. But yeah, I think we're taking things slow now that things are back. We're back in the lab for sure, as you know, like the case changes that have been happening. But thankfully, I think we're kind of getting back on track and trying to not necessarily catch up, but continue with the specific aims of our projects.
That's great to hear that things are back up and running. This is a question from someone in the audience, and I think it relates to this. How do you find the participants who are in your studies? And there may be someone on the call who joined because they're interested in maybe the side effects of e-cigarettes. So how could they participate? Is there a way to participate?
Absolutely. So we do a lot of community-based recruitment. Right now, most of the strategies that we use are online. So we're promoting our research studies using Facebook or sort of on Craigslist or other social media-based advertisements. But we've posted, in VCU Telegram in the past. We've used radio advertising in the past when we're typically for these lab studies, we're recruiting locally. Because we need individuals to come physically here. The center is located right across the street from the Jefferson on Franklin Street. So we're kind of centrally located. But yeah, and if anyone's interested in joining us, they can visit our website and there is a screening survey that they can take to see if they might be eligible for any of our ongoing studies that are happening here at the center.
That's great. And based on your studies, is there a type, and this is also a question from the audience, is there a type of e-cig user that pops up more often than others? I know you mentioned looking at some of your studies in different types of communities and marketing. So I'd be interested to hear if there's a type of young, old.
Yeah, I mean, I guess that's a good question. We have a specific type of user that we're aiming for. When we're talking about exclusive users, we're looking for oftentimes at least a daily e-cigarette user, because we want someone who uses these products regularly to see how our conditions may affect them versus someone who is more infrequent or not a regular user of electronic cigarette products. And I will say things have changed. It was in the past, I think we had maybe more challenges in locating exclusive users. But that seems to be an easier group to target. Dual users, on the other hand, are also very common to people that use both products. But we often don't find most people that use e-cigarettes and combustible cigarettes may use one of the products at less frequency, right? So one of them, like a primary smoker, is more common than a primary e-cigarette user that sometimes smoke. It's usually the other way around.
That makes sense. Dr. Eissenberg, I know you mentioned some of your foresight into knowing that e-cigarettes were going to be the next big thing. Someone asked in the chat, do you see traditional cigarettes totally going away in the future?
Not the way e-cigarettes are marketed now.
Mm.
So I think we have to be really clear about the motive of people who are selling e-cigarettes, which is not to help people quit smoking, but rather to make money. And in fact, the best way of making money is to keep people dependent on nicotine so that they keep inhaling this aerosolized liquid into their lungs for the next 20, 30 years. And so The e-cigarettes that are designed today are designed with that goal in mind, and they're not designed as smoking cessation aids. This is I think the biggest way in which research can inform the world about what these products can and can't do is to address this directly and to design and test products that are actually designed to help people quit smoking. But no, I don't think e-cigarettes are going to contribute to the death of cigarette smoking, because that's not what they're currently designed to do.
That's interesting to say that. I think we all know someone that maybe was a traditional cigarette smoker and used e-cigs to try to quit, but that's just not their intention, as you said. How do you stay ahead of some of the adapting technologies? I know early on we mentioned your study about heat not burn. Is there a way that, are you in touch with the industry, or is it really all FDA or your own research?
This is the biggest bane of e-cigarette research right now, is that the products are evolving so fast that something we publish on today, or rather, I should say, something we submit a manuscript on today, by the time that manuscript appears in print, that product might not even be marketed anymore, or at least not in the configuration that we tested it. And so there are two ways in which we're addressing this. The first, of course, is constant vigilance, trying to identify the next big thing before it becomes the next big thing. We're interested right now, for instance, in oral nicotine pouches, which some folks may have seen at convenience stores, marketed under the name I assume for oral nicotine, or Zyme. I don't know what that's meant to be for. And these little tea bags, very small tea bags that you put between the cheek and gum, and they purportedly deliver nicotine. So that's one way. Just keep your eyes open and see what's coming. But the other is that we tend to focus more on the factors that influence nicotine delivery and withdrawal suppression, and how much people will work and pay to use a product. And those are nicotine concentration, protonated versus free base, the wattage of the device, the dimensions of the heating coil. And we manipulate those things, because that's the same thing that those are the same things the manufacturers are manipulating. And so when we see a new manipulation come out in the world, then we can say, oh, well, we know what that does. We haven't tested that exact product, but we've tested those factors before. And in fact, I'll give a shout out here to my colleagues at Project One and Dr. Alan Shahade's team. They've developed a mathematical model that will predict the nicotine emission rate, the nicotine flux, as Caroline said, of any e-cigarette, either on the market today or not on the market today, but just existing on a piece of paper because someone designed it. It takes into account all those downstream factors, puts them in the model, and then predicts the nicotine emission rate with an R-squared of something around 92%, I believe it is, meaning we can predict with 92% accuracy, or 92% of the variability explained, how much, what the nicotine flux is for that product.
Wow, that's great. It's really important work, and good to know that you guys are staying ahead of the game and really focusing on that. I'm going to ask two more questions. One more is, have you explored the effects of people that recovered from COVID and then perhaps gone back to smoking? I know we've heard a lot about smokers are at a higher risk for COVID, that it can more heavily impact them.
The work so far that we've done in relationship to COVID-19 has primarily been a survey that we actually performed online in the early months. So I believe it was like March, April time last year. And we actually did survey smokers and non-smoker, or survey smokers and e-cigarette users. We weren't recruiting specifically for those who had COVID-19, but we asked about it. And so we gathered information about their symptoms and kind of their behaviors around that. We didn't actually have very many cases, because probably at that point there weren't as many in the United States. I'm sure if we repeated the study now, it would be quite different. But we did gather quite a bit of information about what they were doing in response to what was happening around the pandemics. Had they changed their behavior? Had they reduced their smoking, regardless of their diagnosis status? And so and we actually have a publication that was recently accepted looking at those, the behaviors that people said that they were doing, and they're changing in smoking or e-cigarette use, and how that related to their perceptions of risk. So whether or not they thought that their perceived risk what was protective or not protective. So we asked them, do you think vaping protects you from COVID-19? There is a perception that that is the case. There's also the perception that some people think that smoking protects them from COVID-19. And so we looked at the relationship between those perceptions and their self-reported kind of changes or no changes in behavior.
Yeah, I'll add to that. The protecting thing was really bizarre. It was our Project 4 team was doing a study of e-cigarette users and changes in response to COVID. And we were getting all these responses about how they've been vaping more because vaping coats the throat and doesn't allow the virus to attach, which didn't make a lot of sense. And so we started looking into various forums because that's part of what Project 4 does. They look on e-cigarette forums and other tobacco users forums to see what people are talking about. And we found just crazy recommendations about vaping and how it should protect you from COVID. And we actually wrote an editorial that was published, I think, a couple of months ago now on this very topic and suggesting to healthcare providers when they see somebody who uses an e-cigarette in a clinical setting to really make very clear that there is absolutely no evidence that it's protective and there's growing evidence that it's harmful.
That's really interesting. I think COVID has been a mystery to so many, and I think what people think is truth is we're learning more and more that it's not. I think one final thing I want to ask is, do you have any upcoming research projects that you're particularly excited about, or anything the center is doing that we can follow and know about in the future?
I can address that. So the NCI has paired with Cancer Research UK for what they call their Grand Challenge program. And there are several grand challenges. I think there's 9 questions that some people could form a team to address. And one of them has to do with electronic cigarettes. What are the benefits? What are the harms? And so I put together an international team. And I don't want to get into too much detail because it's just a grant application that is about to be submitted. I am committed to doing exactly what I said I think researchers should be doing, which is designing the best e-cigarette product that could help smokers quit smoking and then testing it to see whether it achieves that goal. We're talking, when I say product, I'm not just talking about an e-cigarette because that's only part of the equation. We're also going to use a just-in-time adaptive intervention, a behavioral a component that's tagged on to and speaks to the e-cigarette via Bluetooth. And we hope that with the right product, the right e-cigarette product, the right liquid, which is of course unflavored to reduce risk, the device is low wattage to prevent thermal degradation, and with that behavioral component added on, we hope that we could actually find something that would help smokers quit. And the beauty of the just-in-time adaptive intervention is that we'll also get them off their e-cigarette use by the end of the trials that we've designed.
Wow, that's really amazing. Dr. Cobb, do you have anything you want to share?
Sure. We actually are about to launch a study, hopefully actually in the next month or two, where we are going to be performing a completely remote clinical trial. So we're trying to, reduce risk as much as possible, but kind of try to utilize some of the same outcome measures that we usually collect in the lab. And this study is focused purely on IQOS, that new heated tobacco product, which there is very little kind of independent data actually available because this product's so new. Altria had a lot of data that they collected on this product, which they submitted to FDA, which got them to this stage that it's now out on the market. But we think there's a lot of gaps still around there. And we're also really interested in how these products are really interpreted and used by those in the African-American smoking community. So that's what this study is focused on. So we're going to be recruiting African-American menthol smokers as part of this study and asking them to try these products and really getting information about, how it affects their smoking behaviors, if it helps reduce their smoking. And we're also testing a specific research question around flavors to see whether the flavors of these IQOS products, how those affect those measures in those products. So that's what's coming. I'm really excited.
That's great. Dr. Cobb, Dr. Eisenberg, thank you so much for the stimulating conversation and really a lot of important information that we're so happy we get to highlight today. I definitely will be looking out for more papers and research that the center is doing. It's really important work. Connor, I don't know if you had anything else you wanted to say to close us out.
Yeah, and if it sounds like deja vu, it's because I accidentally pasted it into the Q&A section. So you gotta love that virtual world. But just want to thank each and every one of you for joining us today, including Doctors Cobb and Eisenberg. We recorded today's session and we'll have it available on YouTube and Facebook in case you want to share this information with any of your friends, coworkers, or family. And speaking of Facebook, we hope you will follow the Massey Alliance on Facebook and Instagram to stay in tune with our opportunities to get involved in the future. We are currently actively planning for a version of Richmond Brunch Weekend this spring that will allow our supporters to support local restaurants, very important, and give back to Massey. And we're also continuing our plan for the reboot of Massey on the River next fall, so please stay tuned. And while we know that many things have changed since the pandemic has started, including our ability to gather together for Alliance events and social hours, one thing hasn't changed, and that is the need to absolutely support critical cancer research. Again, we thank you for attending today and for continuing to support the meaningful work of VCU Massey Cancer Center and our research members. So thank you, everyone, and have a great rest of your day.
Thank you for the discussion.
Yeah,
Great.
thanks for having us. I appreciate it.
Thank you so much.
Bye.
Everyone.